Through it, we must maintain confidence in who we are.
First of all, early detection is the key. Second of all, for those of them who are married, who basically have lost hope or have low self-esteem due to the image, you have to look beyond that and see yourself, like I always tell women, try to look more beautiful than those that never had breast cancer so they can wish they were you. And, well, I had a huge problem with body image, of course. I had a mastectomy. And to me, at the time, was really painful because it really kind of affected my marriage. At the time, of course, as a woman, when you have a mastectomy, you look at the mirror every day, it looks at you, and you see, the deformity, and you basically have that wall between you and your husband. You don't want him to look at you that way, and you wonder what people will think. But, today, I'm just happy.
When you have a diagnosis of breast cancer, and if you elect to, or you must, say, have the breast removed in its entirety, think about reconstruction. Think about breast mound reconstruction, as we call it. It is something that is readily available. If you're healthy otherwise, some type of reconstruction procedure can be done. So there is benefit to bring up the question about reconstruction if your surgeon doesn't bring it up in the course of their recommendations for treatment, especially when they recommend that the entire breast be removed or you decide this is what you want to do.
For a while I felt like less than a woman, because that's what, no breast, they think, I felt like more manly. But he let me know, he said, no, that has nothing to do with it. He said, you are a woman, He said, I love you because you are you. So I didn't have a problem with that after that.
A lot of women, they attach themselves to their body parts, and I felt if that was going to be a harmful thing for me, I'd rather let it go, as long as I could have my life.
When I found out I was going to have a mastectomy, seemed like, I don't know why, when you're going to have something done to yourself, considering cancer, and when they said you got to have your breast removed, seemed like every commercial I saw was women with breasts. And I was really upset about that.
Most women have choices. Take time to get all the information.
Now, if a young woman came in with a complaint about a breast lump or a breast mass, and they were told not to worry about it or to come back in 3 or 4 months or whatever, I think it's appropriate for that individual to be, say, proactive, and don't feel bad about being proactive, meaning that if they really feel uncomfortable about what they're finding or what they're reporting they're finding, I would encourage them to find a way to get another opinion about whether or not this is something that should be just left to waiting and seeing.
We do not need to go through this alone.
Well, I know my mother as far as she's a protector for her children. And she decided that she was not going to worry us because we were already concerned with her diagnosis of multiple myeloma. And as a result of that, she went into mommy mode. The mommy bear protects her babies. So she was protecting her children until she had made a decision in her mind of what she's going to do. And this is my decision. And we appreciate it. I would like to have been brought in a little earlier because I am the daughter and I can be some of assistance if you allow me to.
Well, now I feel that other women, they should share their experience and diagnosis as early as possible with their families, especially if they have young children, young girls, teenagers. They need to share their concerns and experiences with their girls and with their sons, so that if this ever happens to them, they'll keep their family abreast of what's going on with them, and know that if they get in to the doctors early, get your tests, get into your doctors early, so that you have a better chance if they do diagnose you with breast cancer, that they should experience this with their families earlier, so they can keep their families abreast of what's going on, and not be so, protective of yourself. I know you don't want your families to worry, but they're going to worry whether you tell them or not, because they're going to have all these things going in their head of what's going on. So if you experience with them earlier, I think it would be better for your family.
What I would have changed if I could go back is to just kind of step in more. I mean, I was young, I was 15, I didn't know that much, but I would have tried to do more for her than she was willing to allow me to. And I think I could have helped her a lot more.
I just explored different avenues to help me see how more could I be a support system to my sister, because I believe that it's a team effort, and don't rule out any kind of support that may be helpful to you.
When we found out about the first breast cancer support group and he joined, he loved this support group. One, you got a lot of information from support groups. People were coming to support groups from different doctors and from other different groups, bringing all kinds of information, cutting edge information that you could use to kind of critique the treatment that you were getting yourself. And then the compassion from people who absolutely understood exactly what you were going through without your having to tell them everything.
And I had a wonderful auntie who had, not blood-related auntie, but she was a cancer survivor whom I called on to all the time and try to ask questions as to this is the stage I'm in, how do I go about this? And it was really difficult. We didn't have that much support system around, but I had family and friends who were there to support me. My mother had to fly all the way from Africa to be with me, because it was very heartbreaking for a mother to witness a daughter go through the pain.
There is so much wisdom to be gained and shared.
Every woman, and the physicals, every man, everybody needs to be their own health care advocate. A little bit of discomfort for a little bit of time can save your life. Don't be afraid.
The best protection is early detection. That's what Eunice would say. And especially, he always had a message for the men, because he said, you men don't want to go to the doctor. He always had that message. And about the breast cancer, he'd say, here I am, I'm living proof that men do get breast cancer, so don't ignore it. Go to the doctor. Be brave. Do not be afraid. Get all of the information that you can get. Have somebody with you, but just don't focus on the fear. Focus on getting information about the disease, about the treatments that are available. Have somebody help you choose a course of treatment, and then stick with it. Eunice would say that, look at me, I'm here. I'm proof that just because you have cancer doesn't mean that you're going to die. He still lived a very full life. After his squamous cell cancer, the breast cancer, prostate cancer, we were still traveling overseas. We were still going. We never gave up on life. The year that they diagnosed his final cancer in his lymph nodes, they were looking for us because we still went to Arizona for Christmas that year. And then we came back in January and they were going, well, where have you guys been? But we kept on living. A survivor means you're still alive. So you keep living, you keep putting the quality in your life.
Getting the word out, giving back to others, like a great author once said, what you do for yourself dies with you, but what you do for others in the community is immortal and a legacy. So we all try to leave a legacy in everything we do.
The women you have heard from are a testament to the power of the human spirit. We hope the film inspires all women to support and encourage each other and have faith in the strength of their personal spirits.